Urine pregnancy test. So identify the correct patient and then introduce yourself. Hello, good morning, ma'am. My name is Melana J.D. Molina from Wesleyan University, Philippines. I will be your student nurse for today. Assist the client to the bathroom. So, ma'am, let me assist you to the bathroom. Then instruct the client to collect a clean-cut midstream urine in the specimen bottle. Secure the specimen bottle collected, and after that perform hand hygiene. Wear gloves. Get the pregnancy test kit and read the instructions carefully. The next procedure is put it in the examination table and aspirate some amount of urine. Pregnancy is positive, it's double line, and pregnancy is negative, it's single line. Remove gloves, and then after removing the gloves, perform hand hygiene. The result can be given directly to the patient. Ma'am, the result of your pregnancy test is positive. Document the procedure and result of the client's record. Leopold's maneuver. So first, identify the correct patient. Introduce yourself. Good morning, ma'am. My name is Melana Molina. I will be your nurse for today. And assist the client to lie on bed in a dorsal recumbent position. Woman lie on her back with the shoulders raised up a little. Expose the part to be examined, keeping cover to the other parts. First maneuver, frontal grip. Face the client's head. Using both hands, palpate the fundal area. Expect to palpate a soft irregular mass in the upper quadrant of the maternal abdomen. This determines the shape, the size, mobility, and consistency of what she feels. The limbs and shoulders contain little bones that processes that move with fetus trunk. The head is firm, hard, and round that moves separately from the trunk, and the buttocks is symmetric and feels soft. The second maneuver. The second maneuver is umbilical grip. While still facing the patient, move hands to the lateral side of the abdomen. Perform this maneuver by placing the right hand on the side of the patient's abdomen while using the left hand to explore the woman's uterus on the right side. Repeat this step on the opposite side using the opposite hand. The fetal box is smooth, firm. The extremities of the fetus should feel like protrusions and small irregularities. Third maneuver. Third maneuver is Pollex grip. Move hands down to the lower pelvic area. Palpate the area just above the symphysis pubis to determine the presenting part. Grasp the presenting part with the thumb and fingers of the right hand. This step of the process identifies the part of the fetus that is above the inlet. The last maneuver, the pelvic grip. Face the client's feet. Place hands on the abdomen and point fingers towards the mother feet. Gently move the fingers on both hands towards the pubis by sliding the hands over the sides of the patient's uterus. The side where the greatest resistance to the descending finger is the location of the brow. Assist the client to get out from bed. Perform hand hygiene. Record your findings on the client's record and report your findings to your clinical instructor and to the attending physician. Fetal heart monitoring using stethoscope. Identify the correct patient. Introduce yourself. Hello, good morning. My name is Melana J.D. Molina. I will be your nurse for today. Perform hand hygiene. Assist the client to lie on bed in dorsal recumbent position. Expose the part to be examined, keeping cover to the other parts. Perform Leopard's maneuver. The second maneuver, the umbilical grip. Place the diaphragm of the stethoscope on the client's abdomen where the fetal back is located. Count the beat in 1 whole minute. 2 beats are equals to 1 count. The normal result is 120 to 160 beats per minute. Below or above this range indicates fetal distress. Assist the client to get out from bed. Perform hand hygiene. Record your findings on the client's chart or record and report your findings to the attending physician. Postpartum maternal physical assessment. Identify the correct patient. Introduce yourself. Provide privacy to the client. Set the bed on a comfortable height to work and lower the side rails where you will work. Perform hand hygiene. Check mother's vital sign and record. Wear gloves. The clean gloves. Breast assessment. Position the client in a supine or sitting position. Expose the breast to be examined or the part and keeping others covered. Inspect for the following: consistency, nipple type and integrity, swelling, redness, engorgement, and tenderness. Uterine assessment. Expose the client's abdomen covering the upper part of the lower extremities. Assess the tone, height, and location of the fundus or fundic height. Immediate after birth at the level of umbilicus, 1 to 2 hours after delivery, midway between umbilicus and symphysis pubis. 12 hours after delivery, 1 centimeter or 1 finger breadth above the umbilicus. 24 hours after delivery, 1 centimeter or 1 finger breadth below the umbilicus. 48 hours after delivery, 2 centimeter or 2 finger breadth above the umbilicus. 72 hours after the delivery, 3 centimeter or 3 finger breadth above the umbilicus. Bowel assessment. Auscultate for bowel sounds and assess for the abdominal distensions. For bladder assessment, ask client for avoiding pattern, presence of pain or burning sensation during urination. Palpate for bladder distension, track fluid balance, intake and output. Lochia assessment. Assess the mode of lochia. Note time of last perineal pad change. Note for the amount of lochia in a perineal pad. Scan small, moderate, large. If weighing perineal pads 1 grams equals to 1 ml of blood loss. Assess the number of days the woman has delivered her baby. The type of lochia or vaginal bleeding is based on this. Lochia rubra, 1 to 3 days, blood is in red color. Lochia serosa, 4 to 10 days, vaginal discharges are brownish pink in color. Lochia alba, 11 to 21 days, vaginal discharges are yellow to white in color. Document the number and size of blood clots. Turn patient to assess for blood loss under the buttocks. Remove medical gloves. Remove medical gloves. Episiotomy and episiotomy assessment. Wear sterile gloves. Place the patient in a lateral position with her back facing you. Expose the client's buttock. Inspect for the following: redness, edema, ecchymosis, number of stitches, consistency of discharge, and approximated edges. Palpate the edges of the stitches using either of your thumb or index finger, noting for the presence of discharges from the stitches and pain upon palpation. Dispose or arrange used materials properly. Do hand washing. Record all the data in the client's chart. Refer any abnormal findings to the attending physician.